Hello, and thank you for tuning into the program. I'm your host, Neal Howard, for this Health Suppliers segment on Health Professional Radio. Our guest is Dr. Joseph Maroon. He's professor and vice chairman of the Department of Neurological Surgery and Heindel Scholar in Neuroscience at the University of Pittsburgh Medical Center. And he joins us today to talk about Omega-3 UltraPure. He's going to tell us what this product is and how it's going to benefit all of us. Thank you so much for joining us today, Dr. Maroon.
Well, it's my great pleasure, Neal, and I always enjoy speaking about Omega-3 and fish oil in general. As well known now, fish oil is one of the very best natural anti-inflammatories that we have. And when we consider that most of the serious and chronic diseases of aging that we eventually acquire, things like heart disease, stroke, cancer, to some extent Alzheimer's disease, and even depression, are all associated with the body's innate immune response and the inflammatory response. In other words, inflammation is a common factor that is associated with all of the things I just mentioned. And the most important thing, of course, is in terms of our health, what can we do to mitigate inflammation? And there are several factors that must be considered.
Are we talking inflammation across the board, or are there certain types of inflammation that do certain types of things?
Well, that's an excellent question. And most people understand inflammation. If you get a splinter under your finger immediately becomes hot, tender, and swollen. That's the body's inflammatory response to a foreign body or puncture wound. However, more significantly, or just as significantly, is the fact that a condition called silent inflammation is going on in our bodies every day, depending on our diet, how much we exercise, our control of stress, and environmental toxins. So, as a prelude to talking about omega-3 fatty acids, which is essentially fish oil, it's important to understand why it may be important to take fish oil, and that is because it's a major natural anti-inflammatory. People take ibuprofen, they take all sorts of naproxens, and history shows us that Vioxx, a very highly touted anti-inflammatory drug, was associated with many deaths, so that anti-inflammatories are a primary prescription item for many of the things that we occur, and doctors write prescriptions for. And what I'm saying is that we can take anti-inflammatory approaches to our health every day into our own hands by the food we eat, how or not we exercise, and how we control stress. All contribute to inflammation. So getting back to fish oil and Omega-3, it's much better, in my opinion, and I've demonstrated this in scientific studies that I've done in patients with back and neck pain and arthritis, that natural anti-inflammatories, in my opinion, when indicated, are clearly superior to pharmaceutical anti-inflammatories, which all have very significant side effects. 17,000 people a year die from the use of ibuprofen due to stomach ulcers. I don't know of anybody that's died from taking fish oil, and yet scientifically they both work along the same mechanisms.
If I can ask, why is it that if fish oil or derivatives thereof are so superior to pharmaceuticals, I know you're here to promote the benefits of fish oil and supplements that come from it. But why do you think that there is so much dependence upon these non-fish oil drugs?
Well, I'm not saying that fish oil is superior. I'm saying in many cases it's equivalent.
Okay.
I'm not saying it's superior, but I'm saying it's equivalent and oftentimes a very good alternative to pharmaceutical drugs, all of which have significant complications that are anti-inflammatory. Natural products have very few complications, if any. So that if you have a choice, and again, it depends on the underlying inflammatory process. So if we're talking about prevention of cardiac disease. There are Omega-3, for instance, can lower your triglyceride. It can clearly benefit heart health and reduce inflammation in a very effective way, maybe before you go on a statin or other types of expensive and drugs that have side effects. So I'm not saying it's superior. I'm saying it's an alternative to try with arthritis in my own case. I still compete in Ironman triathlon distance races. And for a while, I couldn't get out of bed without taking ibuprofen. Mm-hmm. I was so sore every day. And that's how I got introduced to omega-3 fatty acids and fish oil. I found that I could get off of the non-steroidal anti-inflammatories by taking a natural product. And that's how and then I subsequently did a study of 250 patients who came into my office with back and neck pain, all on non-steroidals. And we published in Surgical Neurology International that 60% of the patients were able to get off of non-steroidal anti-inflammatories by taking a high-quality fish oil. So that's my position.
Now, as someone who's experienced this transition, describe it. We talking obviously not overnight, but maybe a month to 90 days. Is it that type of time frame that we're looking for some readily noticeable changes from switching?
Yes. Most people are deficient in omega-3 fatty acids. They don't eat enough fish. They don't eat enough nuts and or flaxseed, which is helpful but not nearly like fish oil. So we're deficient to begin with. So it takes a few weeks to get your blood level up to a sufficient level, and then within 1 to 2 months, I've seen just so many dramatic results in patients with knee pain, arthritis, in my own case. And it's just very beneficial. We've written a book on this, fish oil, the natural anti-inflammatory, which is available on the Omega3 website, that explains everything we're talking about in understandable language and is readily available.
Now, Omega3 UltraPure, you're just one of the doctors that's responsible for bringing this product to us.
The formula was discovered in quotes by investigators at Yale University quite a few years ago, and they found that it could very dramatically lower triglycerides in patients with cardiovascular issues. And then subsequently, it was found that it had helped in many other instances. And the value of Omega-3 is, number one, it's very highly concentrated. It's 93.9% pure fish oil. If you look at almost all other products on the market, few, if any, reach this degree of purity. And number two, it's encapsulated in individual blister packs. One of the difficult things about fish oil is it becomes rancid when exposed to air. And that's why you go into a fish market, you smell the fish before you buy it. Absolutely. Because fish will spoil, and fish oils will spoil when exposed to air. So when you buy a bottle and you open it and you don't take it regularly and you go back to it and you smell it, it smells rancid. And by individually encapsulating these in blister packs, it keeps the air out, it preserves the components, and it doesn't become rancid. And the quality and the purity is very high.
Now, when we go online and look for more information about Omega-3 UltraPure, are there other products that are developed that you're involved in as well, based on these omega-3 fatty acids? No,
this is the only one that I support, and I support it because I take it myself. Mm-hmm. And the health benefits, brain health. At the University of Pittsburgh, some researchers showed that fish oil was also a mild antidepressant. So in terms of emotional health, it can be beneficial in that regard. Joint health, cardiac health, so that it's something that every cell in our body, the cellular membrane is composed of essential fatty acids. And the best way to get that is to eat fish, preferably flown in from Alaska, to avoid the mercury contamination, which is ubiquitous in most of the fish we eat.
Absolutely.
And so you want the purest form. And Omega-3 goes through 5 steps of molecular distillation in terms of removing all of the purities. And probably the best test is do what's called the freezer test. If you're taking fish oil now, take 2 of the capsules, put them in a freezer, and look at them the next morning. You'll see that it's cloudy and opaque due to the precipitation of the impurities in the fish oil. Then put the Omega-3 in, and you'll see it's naturally clear. Fish need essential fatty acids to preserve from freezing at the depths of the ocean, so that you want, and it has to be pure. So anyway, that's the so-called freezer test that's worthwhile doing. It's available online at the Omega-3 website, and it's something that definitely should be considered as a natural anti-inflammatory and a supplement that affects virtually all of the systems in our body in a positive way.
Well, thanks for coming in and speaking with us today about Omega-3 UltraPure. It's been a pleasure, Doctor.
My pleasure, Neil. Thank you.
You've been listening to Health Professional Radio, this Health Suppliers segment. I'm your host, Neal Howard. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page when you visit us at hpr.fm.